Hello, I'm Dr. Virender Sekhon, consultant pediatric urologist. I'm often asked, who is a pediatric urologist and what do they do? So a pediatric urologist is a specialist who looks after the urinary tract or the genitourinary tract as we call it for children. So any trouble which is related to urine problems or related to genitalia of both males and females are taken care of by a pediatric urologist. The spectrum of anomalies that we look after can be very simple, ranging from urinary tract infections, which may again be due to a simple thing like constipation or a bowel bladder dysfunction, to something that we call a vesicoureteric reflux, in which the urine goes back from the bladder into the kidneys and may have long-lasting effects. The other thing that commonly is brought to us is kidney swellings or hydronephrosis, which may again have a variety of reasons, ranging from a pelviureteric junction obstruction, which is a developmental anomaly in which the pelvis and the ureter, which are usually tracts which transport the urine from the kidney into the bladder, may have a formative abnormality in that they are a little restrictive or constrictive in their formation. Most of these anomalies are detected before birth or immediately after birth, and therefore seeking the right opinion at the right time with the right specialist is very important for your children. The other complex anomalies that we look after may be defects in the genitalia, in terms of that the urinary hole may not be present in the right place, something that we call hypospadias or epispadias, and these are normally again detected at birth. So examining your newborn baby either by your pediatrician or you yourself when you are giving them a good bath is important. Some other abnormalities that we look after may be phimosis, in which the foreskin of the penis is actually stuck and cannot be retracted back. A similar enology in females is something that we call labial adhesions, in which a female child may have difficulty in passing urine or may have recurrent urinary tract infections. And in these children, you may not be able to see the internal genital openings as you should otherwise normally be able to do. There are a large variety of bladder dysfunctions which may present as urinary leak or incontinence in children. Now, the normal toilet training age for any child is roughly in the age of 2 to 3 years, and majority of these children should attain a good control by 5 years of age, even for nighttime bedwetting. If your child is beyond that age and is still leaking urine, then you should consult your pediatric urologist for the right opinion. There are a wide variety of other complex anomalies like genitourinary tumors, that is cancers related to the kidney, urinary bladder or the genitalia, that may be a testicular tumor or a bladder rhabdomyosarcoma that we look after as well. Stones in the urinary tract are another concern that falls in our field. There may be small stones in the kidney or maybe larger ones again in the kidney or the urinary bladder or the ureter, and they can be tackled by minimally invasive techniques without any surface cuts. The other complex reconstructive anomalies that we particularly look after is something called an extrophy epispadias complex. These are complex genital reconstructions ranging from complete incontinence in babies, where we reconstruct the entire bladder and the genitourinary system along with the anterior abdominal wall, and help these children attain continence as they go further. So if your child has any of these conditions, please do contact your nearest pediatric urologist for the right treatment and the right opinion. Thank you.